Okay, it is Wednesday, and that means it's time for Morning Rounds, and Dr. Chris Johnson joins us this morning. He is a urologist at Marian Regional Medical Center and chair of the Marian Robotics Surgery Program Committee. In addition, Dr. Johnson is also one of this year's co-chairs for the Marian Foundation Golf Tournament Committee. You have all kinds of titles. Thanks for joining us this morning. Yeah, exactly.
And so we know, Doctor, that every year they hold the golf tournament. Can you tell us a little bit about it?
Sure. It's the golf tournament is actually run by the Marian Regional Medical Center Foundation, and it's actually one of the fundraising arms for the hospital. And this year, some of the proceeds from the golf tournament will actually benefit the robotics program. The foundation was actually instrumental in bringing the robot, the daVinci robot, to Marian Medical Center. Oh, okay. And so it seemed appropriate that since I'm the director of the program, or at least the physician liaison for it, that I get tagged as the co-chair.
And where is the tournament being held, and when is it?
It's on April 16th.
Okay.
The start off is around 9 o'clock. At 10 a.m. it's a shotgun tee off.
Okay.
And there's a reception at 3:30, and it's at the Santa Maria Country Club. And unique to this annual event is we're actually going to have a daVinci robot there.
Oh, neat.
So the company that builds it, Surgical Intuitive, or Intuitive Surgical, actually has a mobile unit that they bring on site, so that anyone that's interested in participating in the tournament, which we're still looking for golfers and sponsors, will be able to play around with the daVinci.
And why is this technology important for Marian's patients?
It affords us the opportunity to do minimally invasive surgery with quicker recoveries and better outcomes. We're doing now, for instance, I did an operation yesterday on a patient with a blocked kidney. Usually that patient that would, if the daVinci was not available and you were going to do it in the traditional open technique, the patient would have a huge incision and be in the hospital for 4 to 5 days, have a lot of pain on the recovery. Instead, this patient has a couple small little incisions and is going to go home today.
Wow.
And so her pain requirement is going to be much lower than what we normally would see with the open approach.
Would you say that daVinci is transforming surgery?
Yes.
As we know it?
Certainly in urology it has.
Yeah.
It actually has a huge impact on pelvic surgery because it's a very small space operating in the pelvis of a man and woman. And so in gynecology and in general surgery it also has applications and has really, I think, helped expand what we're able to do and really improved outcomes and recovery times.
Yeah.
Very cool. And I keep checking out your prop over here.
Yes.
Is that one of the arms?
This is an actual arm that actually we've used for surgery.
Oh,
and
wow.
There's a number of different types of arms that we use, but this one is actually called the Pro Grasp. And if I can get it to open, it actually has a grasper on the end here that opens up. But you can kind of see how the arm moves. Now, when we're doing the surgery, we actually sit at a console and control this. And we actually have 4 different arms, one with a camera and 3 individual arms that actually do the operation that we control. And so you can see, I'd much rather have a small little incision that this slides through than something that these slide through.
Exactly.
Exactly. Well, thank you so much for joining us. We certainly do appreciate it. If you have a question about your health, send it to morningrounds@KCOY.com. And thank you again, Dr. Johnson. Stay with us. We'll be right back.